And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna. Today's video, we're going to be talking about cervicogenic dizziness. That is dizziness brought on because something is not right in the neck. It's been a while since I've talked about this, and there's an additional test that I've been implementing in practice that I'm finding is really useful for identifying when dizziness may not be coming necessarily from the inner ear, but actually from the neck. So in this video, I'm going to talk a little bit about some of just the basic neurology, some of the stuff that's involved, but then a few tests and a few things that you can actually do on your own to help improve these kinds of conditions. Let's jump into it. First up, I'll draw your attention to this particular article. I'm going to give you the briefest summary of it. I was reading this one earlier in the year. This is an excellent overview of the nature of dizziness brought on from a whiplash, from a wipeout, from a concussion, some type, oftentimes past injury that accumulates over a period of time and starts to affect our balance system. In brief, it's a very difficult condition to diagnose. Part of the big reason is because there's no one test that helps isolate it. In brief, in order for us as human beings to be able to stay upright and maintain a sense of balance and equilibrium, the three major sources of input, which are going to be our eyes, our inner ear, the joints of the neck, and if I would add a fourth one in there, I'm going to also include the ankles. They have to send the right kind of information to a particular part of the brain. It's called the cerebellum. I'll talk about that a little bit later. And that information all has to be in harmony. It has to be synchronized. If, however, you're getting abnormal input from one of those systems, that can make us start to feel really gross, really dizzy. One of the hallmarks is if a person knows that you're experiencing dizziness, but you also have degenerative arthritis in the neck. That suggests that there's damage, and at the very least, the cervical spine can be a contributing factor, maybe not the sole thing, but a contributing factor to what is actually going on. So I'll give you a bit of the neurology, and then I'm going to show you a couple of tests that can be done to identify if that could be the case. All right, first up, I've got this horrible diagram for you that I have to admit has become one of my personal favorites. It's a structure of the brain, namely the brain stem, the pons and the medulla, that's known as the medial longitudinal fasciculus. Don't worry about the fancy name. But in brief, you've got signals that are going to be coming from the inner ear and also from the eyes, and they have to be working together in order to maintain clear vision when we're moving our head around, when we're moving our head like this. And so there is a huge amount of neural traffic that goes toward coordinating these normal reflexes that help us know where our brains, where the brain is and our head in open space. And all of that sensory input, it also goes to a very important structure in the brain called the cerebellum. It's located in the back of the skull, basically right through here at the base of your skull, where the head is going to meet the upper part of your neck. If you think of the vestibular system or the eye system as being the major sources of input, the cerebellum is the region of the brain that integrates all that information in order to know what an appropriate output signal is going to be. Do we need to change our head position? Do we need to turn it like this? Do we need to change posture? So it's continuously receiving information from the inner ear and also from the eyes. But guess what? It also receives a huge amount of input from the joints of the upper neck. The muscles, joints of the upper neck, they're not really designed so much for movement. Well, the joints are, but not the muscles. They are more sensory input organs that help to balance this system out, kind of like a universal balancing account, if you would. The kicker is if you've ever had a whiplash type of injury, then it can start to throw that system off, and it can start to manifest as abnormal balance issues that of all weird places can show up in your eyes. So here I'm going to get to some of the different tests that are done that can help isolate if we have problems going on. So the first one, it's actually assessing the cervical spine, but indirectly by engaging the vestibular and also the visual systems. Like I showed you, all of that has to work smoothly. So it is a movement that's called a smooth pursuit. Simply put, and ideally this is done with somebody else in front of you because they're looking for a certain phenomenon. But what you would have is you would have your finger like this, and you are slowly moving it, so approximately like this, 1 to 2 seconds across like that, and you are simply tracking it horizontally with your eyes like this. Under normal circumstances, the eye should be moving smoothly like this. However, there's a phenomenon that can be known as a saccade or a saccade. In brief, what it is as you're moving, if your brain is not able to process the information, it's going to glitch. And instead of your eyes moving smoothly across, what they're going to do is they're going to skip across like that, or a person's going to start engaging the neck like that. Again, this is more useful if you have somebody else looking at it, but if you see where the eyes skip, or at the end range of motion that your eyes start flickering a little bit like that, and you start feeling blurry vision, that is a sign that that neural network that we just showed you is getting overloaded in that particular position. Now, what does that have to do with the cervicogenic component? Because this is where it starts to get really, really tricky. Because when you are doing a test like that, you can't isolate, is this from the eyes, is this from the inner ear, or is this from the neck? Because all of them are involved. But the researchers in this particular paper that I referenced, they're doing a subtle variation of that test. In brief, you have a person turn their head like this, and then you do the exact same test. You have it turn one way, turn it the other way, and you have a look to see. You're keeping the head stationary, but if the only change that you have done is rotating the head, then that means that the upper joints in the upper neck have been engaged, and if there is a problem there, it is more likely to bring it up toward the surface. So instead of seeing that smooth eye action side to side like this, you start seeing that saccade, that giant flicker occur, or you notice that your eyes go blurry in the process. So that can be useful if you've been having these different kinds of symptoms and wondering what is the cause. Again, may or may not be, but if you notice your vision gets blurrier when your head is turned either left or right, especially if you have eye movements or rapid things where you have to keep track of it with your head in a turned one way or the other position, that suggests something is not right in the upper part of the neck. It is sending abnormal signals up to that cerebellum. It's overloading the neural networks. And as a result, you need to do something in order to address what that underlying issue is. Now, there's not a one-size-fits-all solution because many times this is only a contributing factor. People can have a lot of vestibular issues going on. And for that, you're best off seeing a vestibular physical therapist or a functional neurologist. But if you're identifying that there is a cervical element, this is oftentimes where a specialty known as upper cervical care, it's a type of chiropractic, no twisting, no cracking, but works to restore the normal function of those joints so that brain can start working more the way that it should. And that is something that I am seeing happening over and over in my own practice. People are describing dizziness. So I'm doing this little test for them. I find, whoa, eyes are blowing out. They get super blurry. We make a correction for the upper neck, and suddenly we can do that test. And then they look at me like, that was a lot clearer. That's pretty cool because when you make a change in the neurology like that, what you've shown is you didn't just improve the function of the neck, you improve the function of the brain. And when it's going to happen like that. Now, it doesn't mean that everything is fixed forever and ever, amen, just from one magic little adjustment, but it means, aha, that is a piece of this, and we can go toward making restorative changes over a course of care. Now, at the same time, there's a lot to be said for retraining your brain how to reintegrate all of that information. So you might be wondering, what in the world are we wearing right here, where we're wearing these glasses that has this little laser on the top of it, which is definitely showing both my age and immaturity. In brief, this is a test. It's known as a joint position error test, but can also be used as part of the rehabilitative process for a cervicogenic dizziness. In brief, you print out a little target like this, and you put it on the wall about 3 feet away from you. And what you do is you're going to line your body up in such a way, and I'm just going to kind of use this where you would imagine that the middle part of the laser, you try to line your head up so it's right in the middle of this circle right here. The way that this test is done is you close your eyes and you move your head in one of 4 directions. You bring it down and then you bring it back to middle. You can also go backward, and you can also go left, and you can also go right. Now, for testing purposes, you can do this both electronically, or you can have somebody do this in office. There's really cool technology out there known as neck care. This is not for the consumer, but this is something that we use in our practice where you can test for these kinds of phenomenon. In brief, what you would expect is if you had, for example, you close your eyes, you look down, and then you bring your head back to whatever you believe is normal. It should land somewhere in the green. Even if it's all the way off by like 2 or 3 degrees, that's usually a-okay. But when it starts to exceed 4.5 and certainly 6 degrees, so we say, let's say, okay, go down and then bring it back up, and then you overshoot and you end up being something right here. That's a telltale sign that the joints of your neck are not sending the right amount of information to your brain. Your brain doesn't know where you're headed is open space, and that then is going to be a contributing factor to what's going on. So it's done looking down, looking backward. It's also done looking left and looking right. But the way that you can do this for rehabilitative purposes, you can get a relatively inexpensive pair of glasses like this. The brand that was recommended to me and the ones I'm wearing right here, it's from a company that's called Nerd Solutions, N-U-R-D, so neuro, get it? And what you do is you then set up like this, you close your eyes and you do the movement, and then if you end up making a persistent error, so let's say you're overshooting like this, so you look down, then you look back up, but then you open your eyes at the end, and then make the correction to bring your head back to what true center actually is. And you do a series of repetitions until you're ultimately learning, yep, you're reinforcing that pathway. No, this is what true center is. Like working a muscle, you do that with neurology enough times into the area where you have weakness, and you start to create a new pathway that goes a long way towards rehabilitating the brain, making things function a lot better. So just wanted to do a really quick video here for you guys. Again, giving you just a little bit more information. Number one, what a cervicogenic dizziness is, what some of the neurology is involved. A little test that you can do at home. Again, if you feel dizzy or blurry vision when your head is turned to the side and you're trying to track a moving object, odds are something is involved with the neck there, but then also a few of the strategies and things that you can do to feel better, but also retrain your brain so that you're able to function at a much higher level and actually heal from whatever these things are that's going on. Certainly, there's a lot more to it, so please make sure you check out some of the other videos on the channel that I've done about dizziness, about vertigo, about concussion, because huge amounts of overlap with all of that. And if you want some more information or to find out what can we do to actually help you out, you can go over to our clinic website, which is clearchirospokane.com, where we've got a lot of other videos, blog articles, research, all kinds of different things to give you the best possible resources so that you know this is what you can do to actually heal, start feeling better, and enjoy the life that you really want. Thank you guys for watching. If you did enjoy it, please always make sure to click that like and subscribe button and share this video with friends or family members if you believe that they'd have benefit from watching this. This is Dr. Jeffrey Hannett, Clear Chiropractic. Get well, live well, stay well.